Informing Nigerians that we are commencing another phase of our four-phase strategic vaccine rollout plan. I also want to appreciate all Nigerians, especially those who have received their full 2 doses of AstraZeneca vaccine during the first phase, which closed in July. As you are aware, the third wave with the Delta variant of the virus is here with us. This has resulted in upsurge of COVID-19 cases in the last few weeks. The arrival of 4,080,000 doses of Moderna vaccine donated by the government of the United States and the 177,600 doses of Johnson & Johnson vaccines out of the 29+ million doses the federal government has purchased through the African Import-Export Bank and the African Union is highly encouraging and motivating for us as the Presidential Steering Committee. Your Excellencies, continue to monitor with concern the increasing trend of COVID-19 cases in several countries, with special focus on those with high incidence rate and widespread prevalence of variants of concern. While government deeply empathizes with families who have lost loved ones to this virus and assures them that we will continue to do everything possible to minimize the surge of COVID-19 cases in Nigeria, citizens are strongly advised to minimize all non-essential international travels by land, air, or sea at this time, especially to countries that are showing rising numbers of cases and deaths from COVID-19. Consequently, restrictions are placed on travelers from Brazil, India, South Africa, and Turkey into Nigeria in line with our travel guidelines. Individuals, transporters, and airlines who flout the guidelines shall be sanctioned. State governments are required to ensure all returning travelers from all these countries adhere to the mandatory 7-day self-isolation period and the repeat of the COVID-19 PCR test on the 7th day after arrival. Violators will also be sanctioned accordingly. After vaccination, you will continue to observe the non-pharmaceutical measures, the wearing of masks, washing of hands frequently, maintaining physical distancing until we have vaccinated enough eligible Nigerians to achieve herd immunity. Having said that, let me continue to urge Nigerians that COVID-19 is nowhere gone. It's still very, very much around with us. And we must continue. I emphasize that the only way to safeguard ourselves and our loved ones is to continue to adopt the non-pharmaceutical measures, which is the most likely cure we have for now. Wearing of face masks or any form of covering, washing our hands or use of sanitizers, maintain social distancing or physical distancing, and let's avoid large congregations for now. It is therefore my singular honor and privilege to officially flag off phase 2 COVID-19 vaccination in Nigeria on this day, Monday, 16th August 2021, to the glory of God and for the benefit of mankind.
To let all Nigerians know that these vaccines are safe and they have been tried and tested. We have not lost anybody to it in Nigeria. There are people who have had small complaints, but none of them has been fatal. And then to urge everybody to participate, we are looking for at least 70%. And the way things look, because we observe what goes on in other countries, it will probably need more than 70% of our citizens to give us herd immunity. There are countries today which are still suffering despite a large percentage of vaccinations. Those who have had 60% are still having very high cases, and their health systems have been overwhelmed. Our health systems are still standing up, and even though we have been commended for the response so far, it is dangerous for us to rest on our oars. We need to continue to work together. It is not the work of government alone. All of you, all Nigerians are involved. And particularly all of you who are here in the media, who send out the messages to tell the citizens that it is a job for everybody. Nobody is exempted from it. Wear your mask, observe social distancing, know that we are fighting a very dangerous disease that changes its forms, the mutation that gives us concern. Right now we are dealing with the Delta variant, and those of you who were watching the news, international news, will have seen the havoc that it did in India and in other countries. We do not want to get in that situation, and that is why this vaccination is extremely important for everybody to take seriously. It has been tested, and the MPHCDA has prepared very well to deliver it. As has been said, some vaccines are reserved for hard-to-reach areas, security-compromised areas, and also itinerant workers and nomadic people who will not get a second chance for a second vaccine. So the plans are very intricate and very...
Oh yeah. Minister.